All right, thank you all for having us today. I'm Ryan Bramble. I'm the Senior Director of Product Development for CRISP, which is a non-for-profit health information exchange that serves Maryland, DC, and West Virginia. And my colleague Mike Banfield here is going to demonstrate our Smart on FHIR app in just a bit. But first, I wanted to explain a little bit about what CRISP is and what an HIE is for those of you who might not be familiar. An HIE, or a health information exchange, essentially is tasked to move clinical data between participating organizations so that when a patient seeks care, the right information is available at the right time from all over the place. Fundamental piece of what we do is move information around, but we also notify providers and care managers and case managers when patients are having events inside the system, the health system inside the region. I think the big part of our success is really more about partnerships and less about technology. So adopting partnerships through cooperation and collaboration is really our vision. And our guiding principles are sort of what we use to follow, what we follow when we built our Smart on FHIR app. So manageable scope, remain incremental. Our software development teams are very agile. And we'll show you the fruits of their labor here in a minute. CRISP essentially acts as the health information exchange for Maryland and DC and provides the technical infrastructure for West Virginia. We also have partnerships with Virginia and Delaware. This slide is just meant to say we've got a lot of information that's moving around from a lot of the region's health systems. All the hospitals in Maryland and DC send data to CRISP. A number of ambulatory providers send data from their EMRs to CRISP. We also serve a lot of public health use cases in these regions. We are the PDMP, the Prescription Drug Monitoring Program for the state of Maryland, so Schedule 2 through 5 opioids come through the system, along with a number of other things. And then we have partnerships with Delaware and Virginia where we're notifying those states about encounters their residents are having within our system. So by the numbers, there are about 100 hospitals that are sharing something with CRISP, another 130 post-acute care facilities, the big outpatient labs and radiology centers. We have about 18 million patients in our master person index. And we are sending just a lot of information out and getting a lot of information in every month. We're notifying providers in the community about hospital and outpatient visits about 3 million times a month. Folks are doing manual queries. But we've really tried to move into embedded into your workflow from a technology perspective, getting our technology embedded into your workflow. So as a provider, you're not jumping out to a portal. You're not having to remember a password. You're not having to do patient searches and those kinds of things. And while we offer sort of a single sign-on approach from EHRs into CRISP, into the CRISP portal of web information, we really wanted to actually get past that as well. We wanted folks to be in the screens, they're in their EHR, and they see information from CRISP right in context of what they're doing. They're alerted if there's an opioid that they need to be aware of that has been filled previously, or if there's been an overdose in the patient's history. So we started to organize around microservices and APIs to make information more readily available in the standards-based ways that folks are moving towards. So we did this in a couple of ways, and it really goes to our strategies of getting discrete pieces of information into workflows, and then also helping with the providers to develop workflows that are more efficient for them. We just don't want to sort of make a product and then hope providers implement it in a way that works for them. We want to sit with them and make sure we're doing it in a way that works for them. So we've taken a couple of approaches to make key pieces of information available through our APIs. So the Smart on FHIR app is one way to see the information, and that's the demo Mike will give here in a minute. We also have FHIR-based APIs and some non-standard APIs as well to get lightweight information sort of quickly inside the provider's workflow. We're not looking to deliver the entire CRISP virtual health record for a patient that might be made up of 20 facilities and a bunch of lab results. We're looking to identify the critical things providers need to see when they're treating a patient. And if they want to go out and see more, they can always get into CRISP the old-fashioned way and look up, scores of lab results and radiology reports. But we targeted, with the help of our clinical committee, which is made up of providers, this list of things here to get right inside the workflow so that a provider can know if something critical is happening. Care alerts, which is essentially for the patients that have the highest utilization. What about this patient do I need to know if they show up in my ED? The PDMP data, fills from the PDMP need to be readily available. This is in support of a law in Maryland that requires any prescriber or dispenser of a controlled dangerous substance to check the PDMP before they make that prescription or dispense. And quite frankly, the providers were going to have a lot of trouble doing that if that information wasn't available right within their EHR. Overdose alerts based on our syndromic surveillance feeds that go through CRISP to the public health departments of patients that have had previous overdoses. We also have public health alerts around infections like Zika. And then some other alerts around recent visits and who the patient's care managers or providers might be. I won't spend a lot of time on this slide, but essentially this app, which we're going to show here, and our other InContext strategies, represents a shift for CRISP from sort of the traditional HIE web-based tools to a delivery mechanism that is more automatic and more readily available in a provider's EMR. And so if you look at the chart on the right there, you can see basically the shaded areas are manual ways to get to the CRISP information. Some of those are a little more automated than going out to a website, talking about single sign-on, which I mentioned earlier. But the line is essentially the number of API responses we have made to providers in their EHRs, Epic, Cerner, Meditech, NextGen, and others, to get those little pieces of information right into their workflow. So it's a big shift in the amount of available information and the ease of accessibility of that information within a provider's workflow. This is, we'll do a demo in a minute. This is a screenshot of a fake EHR with the CRISP app on the right side. So we'll show the app in the web, but essentially providers are able, or organizations are able to embed the app in their EHR as they see fit. It can be a narrow sidebar like you're seeing here. It can be open up into a full window. It can be sort of scaled left and right. It's built in a way that the form factor sort of auto fits the size of the window. We work with the providers, like I mentioned, to get this information, not many clicks, involved in the screens they're used to dealing with, and that tends to vary from provider to provider. It leverages Smart on FHIR launch sequence. It does not currently write back to the EHR. We would love to support that, but at the moment, it's as we work with the EHRs, we are essentially reading patient and provider information out of the EHRs to build the view of this information, which comes from all the different data sources that feed the HIE. So we're going to switch over to the browser now so that Mike can show you how it works.
As Ryan mentioned, there's two strategies, and the app that we're about to show you is kind of one of those strategies where CRISP is curating the provider's experience with the HIE. But our primary strategy is if providers are incorporating these EHRs, very sophisticated programs, and they're living within those workflows, we want to ride within that workflow as much as possible. So long term, we want to leverage things such as CDS hooks or BPAs, best practice advisories, where we can kind of fit within a native user experience rather than rely on an application. For now, we're using an application. So what this is this is just a tool that we built on our back end to help us test Smart on FHIR apps. It's called SOFA Tester. If you can guess what SOFA stands for, Smart on FHIR app. And so this just allows us to launch. Looks like it's not liking the new window. And so as information returns from the CRISP infrastructure, it's presented. So some things might come back quicker than others. When you rely on interstate PDMP, one state might take several seconds to respond, so we didn't want the user to have to wait there for a wheel to spin if another state is taking several seconds to respond. Yeah, let me see if I can make this a little bit bigger. So the preferred user experience, and again the app is responsive, is that the provider is still within their electronic medical record, and the app is just a portion of that screen, so it's kind of iframed. And what that allows the user to do is still document within their EHR while looking at information from the Health Information Exchange. Our most successful implementations to date have been the ones where we're iframed within the EMR rather than hopping out to a separate browser window. So I'll click through a little bit here, but we have our PDMP information, and so things are kind of ordered by tabs. You can show interstate data, you can choose not to show interstate data. It's telling you what information came from where, so we do have a Virginia medication. And again, this is all test data. You have a concept of a care alert, and I think Ryan described what the care alert was, but it's need-to-know information that one provider is communicating to another provider. So if you have a primary care provider that's treating you, they could decide to write a care alert so that when you came to the ED, the provider at the ED would see the care alert and know who to contact and maybe be better informed on how to manage the care. There's overdose notification, so again that's coming from diagnosis within ADT feeds. Care team, this is just informing a provider of the patient's care team who is caring for this patient. Advanced directive, currently in West Virginia and Maryland, where we're integrating with several advanced directive providers. And so we'll provide the link to that document, and then you can go out to access that document. Prior visits, what are the prior visits this patient had? ED encounters, hospital, inpatient admissions, and then ambulatory. And we're working towards incorporating emergency medical service interactions in Maryland and West Virginia. Additionally, the provider can communicate feedback, maybe just on the app in general, or if they feel like information they're seeing on the patient is incorrect. This is a secure form and a secure way to communicate that information to CRISP so we can attempt to remediate that. And then the concept of a flag. Currently our flags are CRE or Zika or TB. And so we're working closely with the Maryland Department of Health on what information is valuable to present to a user in this way. I know that presenting C. diff information has helped providers take appropriate precautions within their workflows. So again, it's responsive, and I can kind of demonstrate that. As more and more applications are working toward, like providers are moving towards more phone-based, I guess. Some EHRs are allowing you to kind of prescribe or write orders from their phone apps. And so we also want to support, that ability. So again, this is just to demonstrate that it is still responsive in various phones. So I think you can see that this is an iPhone or whatever phone a provider might be using for this. And if we could hop back to the slide deck. Great, thank you. So again, currently this is provider facing only. If there is a chart, like a kind of patient-facing application of the EHR. This Smart on FHIR app is perfectly suited for that as well. You can display the information to patients, and different facilities could choose what information they wanted to display to the patient or did not want to display to the patient. While we don't support the rights currently within the CRISP infrastructure, we do support the right endpoints, and we leverage those for our own purposes. And so kind of our current status is we're deployed in production with 4 health systems within the state of Maryland. We're continuing to talk to a couple other health systems to deploy the app. We're live in production with 1 EMR vendor, and we're in the deployment process with another large EHR vendor. And we're continuing to have conversations with several ambulatory EHR vendors. One is currently building the Smart on FHIR spec and incorporating us within that workflow. We're looking at about 1,400 launches per week. The workflows, kind of the feedback we're getting, each health system configures the workflow a little bit differently. The trigger event might be when a provider is writing a prescription for a control of dangerous substance, or it may be just a button that a user has to click. And so if a user has to click something, then we're anticipating fewer launches. And it looks like we're out of time. Way forward, just so folks know, we are looking to make our tools and applications open source so the community can leverage the lessons learned. Thank you.